If you're over 60 and taking garlic supplements thinking they're completely safe, you cannot miss today's video, because what I'm about to share could be a total game changer for your health. Make sure you watch till the very end. And if you care about real science-backed senior health tips, hit that subscribe button and share this video so more people can protect their health too. If you're over 60 and you're adding garlic to your food every single day thinking you're protecting your heart, lowering your blood pressure, and boosting your immunity, what if I told you that you might actually be making one of the biggest health mistakes seniors make without even realizing it? And some doctors are quietly warning that certain garlic habits can increase bleeding risk, interact dangerously with medications, irritate your gut, and even weaken your immune response instead of strengthening it. Before you chop another clove or swallow another garlic capsule, stay with me, because today we're talking about the 10 garlic mistakes seniors must avoid, and some of these might shock you. Now, let me say this clearly. Garlic can be powerful. It has been used for centuries. It contains compounds like allicin that have been studied for heart health, immune support, circulation, and even antimicrobial benefits. But here's the key. How you use it matters. Your age matters. Your medications matter. Your digestive strength matters. And after 60, your body simply does not respond the same way it did at 30 or 40. The first major mistake seniors make is taking garlic alongside blood thinners without talking to their doctor. Garlic naturally thins the blood. That's part of why people love it for heart health. But if you're already on medications like warfarin, aspirin, clopidogrel, or other anticoagulants, adding high doses of garlic can amplify that effect. That means bruising more easily, nosebleeds, bleeding gums, in serious cases, internal bleeding. Many seniors think it's natural, so it's safe. But natural does not mean harmless. When two blood-thinning agents combine, the risk compounds. If you're taking prescription medication for your heart, especially after a stent, stroke, or atrial fibrillation diagnosis, this is not something to experiment with casually. The second mistake is consuming too much raw garlic at once. You might have heard that raw garlic is more powerful. And yes, raw crushed garlic produces allicin when it's chopped and exposed to air. But raw garlic is extremely potent. For seniors with sensitive stomachs, slower digestion, or a history of gastritis, ulcers, or acid reflux, large amounts of raw garlic can irritate the lining of the stomach. That burning sensation, bloating, nausea, or worsening heartburn some people feel after eating garlic, that's not your body detoxing, that's irritation. After 60, the stomach lining becomes more vulnerable, protective mucus layers thin, acid regulation changes. So what you tolerated in your 40s may now cause inflammation. Another mistake is taking garlic supplements without checking the dosage. Many garlic capsules on the market contain concentrated extracts. Some are aged garlic extract, some are dehydrated powder, some are oil macerates. The dosage can vary dramatically. Seniors sometimes assume more is better. But high doses may lead to low blood pressure episodes, dizziness, or lightheadedness, especially if you're already on medication for hypertension. Imagine standing up quickly and feeling the room spin. That combination of medication plus high-dose garlic can drop your pressure too far. Falls in seniors are not minor events. They can change lives. The fourth mistake is using garlic as a replacement for prescribed treatment. I understand the appeal of natural remedies, I really do. But stopping cholesterol medication, blood pressure medication, or diabetes medication and replacing it with garlic because you read that it lowers cholesterol is risky. Garlic may offer mild support. Mild. It is not a replacement for a statin in someone with high cardiovascular risk. It is not a substitute for properly managed blood sugar treatment. The danger is not in garlic itself. It's in abandoning structured medical care for something that was never meant to act alone. Another issue doctors warn about is garlic before surgery or dental procedures. Many seniors don't realize this. Garlic should typically be stopped at least 7 to 10 days before surgery because of its blood-thinning effects. Even dental extractions can become complicated if bleeding is excessive. If you're scheduled for cataract surgery, knee replacement, or even a minor biopsy, always tell your surgeon about supplements, including garlic. It's one of the most commonly forgotten disclosures. Now let's talk about mistake number 6, mixing garlic with certain diabetes medications without monitoring blood sugar closely. Garlic can modestly lower blood sugar. That sounds positive, but if you're already on insulin or oral hypoglycemics, stacking effects may cause hypoglycemia. And hypoglycemia in seniors is especially dangerous. Confusion, shakiness, fainting, even accidents. If you ever feel sweaty, weak, or suddenly confused after adding garlic supplements, especially if you have diabetes, your blood sugar may be dropping too low. Here's another mistake that surprises people: cooking garlic incorrectly and destroying its beneficial compounds. When garlic is chopped or crushed, an enzyme reaction forms allicin. But if you immediately throw it into high heat, much of that compound gets destroyed. The trick many experts suggest is crushing garlic and letting it sit for about 10 minutes before cooking. That allows the enzymatic reaction to complete. But seniors often either burn garlic in hot oil, which not only reduces its benefits but creates bitter compounds, or they swallow whole cloves without crushing them, which limits allicin formation. Preparation matters more than most realize. Mistake number 8 is ignoring digestive signals. If garlic consistently gives you bloating, gas, or diarrhea, that may indicate sensitivity to FODMAPs, fermentable carbohydrates that can irritate the gut, especially in people with IBS. Seniors often develop more gut sensitivity with age. The microbiome shifts. Digestive enzyme output declines. Just because garlic is healthy for someone else doesn't mean your body tolerates it well. Health is individual. Another big one, using garlic stored improperly. Old, sprouting, or moldy garlic can harbor contaminants. While garlic is naturally antimicrobial, it can still develop mold if stored in moist conditions. Seniors with weakened immune systems should be especially cautious about food safety. Also, garlic preserved in oil at room temperature without acidification can create risk for botulism. Homemade garlic oil must be refrigerated and used quickly. This is not something to overlook. And finally, perhaps the most common mistake, thinking garlic alone will fix circulation problems. Good circulation after 60 depends on multiple factors: movement, hydration, sleep, balanced nutrition, proper medication management, and stress control. Garlic can be part of a healthy lifestyle, but it's not magic. If someone has peripheral artery disease, severe plaque buildup, or advanced vascular damage, sprinkling more garlic on food won't reverse that alone. It may support, but it won't replace comprehensive care. Now I want to shift the tone slightly because I don't want this to sound like garlic is bad. It's not. In fact, when used wisely, it can be incredibly supportive. The key is respect for dosage, context, and your unique health profile. Let's talk about how seniors can use garlic safely. Moderate culinary use, 1 clove per day in food, is generally well tolerated for many people. Crushing it, letting it rest, and then adding it toward the end of cooking helps preserve beneficial compounds while reducing harshness. If you choose supplements, choose standardized, reputable brands and start low. Always inform your physician if you are on blood pressure medication, blood thinners, diabetes medications, or preparing for surgery. Pay attention to your body. Dizziness, unusual bruising, prolonged bleeding from small cuts, severe heartburn, or stomach pain are signals, not badges of honor. Natural remedies are powerful. That's why they must be respected. Another important aspect is immune expectations. Garlic does contain antimicrobial properties, but megadosing during cold season does not mean you'll avoid every virus. Overloading the system can irritate your gut, and remember, a large portion of immune health resides in the gut lining. If garlic disrupts your digestion, you might actually weaken overall resilience. There's also the social factor. Seniors sometimes increase garlic intake dramatically after hearing about its cardiovascular benefits from television segments or online health influencers. But individual risk factors matter. Someone with stable blood pressure and no medications has a different risk profile than someone on 3 cardiovascular drugs. Hydration also plays a role. Garlic sulfur compounds are metabolized and excreted partly through breath and skin. Strong odor is harmless but can indicate high intake. Excessive amounts may contribute to body odor that affects social confidence, which can indirectly affect mental health and social engagement, 2 crucial aspects of healthy aging. Let's talk about the gut microbiome for a moment. Garlic contains prebiotic fibers that can feed beneficial bacteria. That's good in balanced amounts, but too much can create excessive fermentation, especially if gut flora are imbalanced. Gradual introduction is smarter than sudden high-dose supplementation. I also want to address a subtle but important issue: quality of garlic supplements. Not all products contain what they claim. Some contain very little active compound. Others may not be standardized. Seniors on fixed incomes may be tempted to buy the cheapest option. But quality matters. If you're going to use supplements, discuss with a healthcare provider and choose carefully. Now imagine this scenario. A 72-year-old adds garlic capsules after reading about heart benefits. He's already on a statin and low-dose aspirin. A month later, he notices frequent bruising and a nosebleed that lasts longer than usual. He assumes it's dry air, but the combination may be amplifying blood-thinning effects. This is not uncommon. Awareness prevents problems. Or consider a 68-year-old woman with type 2 diabetes who starts high-dose garlic extract. She feels shaky mid-morning. She attributes it to not eating enough, but her blood sugar may be dipping lower than expected due to combined medication and supplement effects. These are not scare tactics. They are real-world patterns doctors see. Now here's the balanced truth. Garlic, when used thoughtfully, may modestly help blood pressure, support cholesterol levels, and provide antioxidant protection. It may support immune defense during seasonal changes. It may enhance flavor so you use less salt, which indirectly benefits blood pressure. That's powerful in a subtle way, but subtle is the key word. After 60, physiology changes, liver metabolism changes, kidney filtration may decline, drug interactions increase, the margin for error narrows slightly. That doesn't mean you become fragile. It means you become more strategic. If you're watching this and you love garlic, don't panic. Just audit your habits. Are you mega dosing? Are you combining it with multiple medications without oversight? Are you ignoring symptoms? Are you assuming more equals better? The smartest approach is integration. Balanced diet rich in vegetables, fiber, lean protein, regular walking to enhance circulation, adequate sleep to regulate hormones, stress management to protect the cardiovascular system, medication compliance when prescribed, and yes, garlic as a flavorful, moderate ally. I want you to feel empowered, not afraid. The goal isn't to remove garlic, it's to remove the mistakes. So if you're over 60, here's what I'd suggest you do after watching this. Review your medication list. If you're taking anticoagulants, antiplatelets, blood pressure medication, or diabetes medication, ask your doctor whether your current garlic intake is appropriate. If you've been planning surgery, disclose supplements. If your stomach burns after eating raw garlic, cook it gently or reduce the amount. If you're taking capsules, verify dosage and brand quality. Small adjustments can prevent large complications. And remember, health after 60 is not about extreme hacks. It's about steady, informed choices repeated consistently. Garlic can absolutely be part of that picture, but only when you respect its potency. If this opened your eyes even a little bit, that means you're taking control of your health. And that's what this channel is all about, helping you make smarter, safer decisions so you can stay strong, independent, and energized for years to come. When we talk about natural supplements like concentrated garlic extract, most people focus on what it does for the heart, the immune system, or circulation. Very few people stop to think about what the body has to do in order to process it. And that's where things become especially important for seniors, because once you cross into your 60s and 70s, your liver and kidneys do not function the same way they did at 30 or 40. The change is gradual, often silent, and completely normal with aging. But it changes everything about how your body handles concentrated compounds, including garlic extracts. Let's start by understanding something simple but powerful. Every capsule you swallow does not just work. It must be absorbed, transformed, filtered, and eliminated. Your liver is the main processing center. Your kidneys are the filtration system. When you take a concentrated garlic extract, especially standardized or aged forms, you are introducing sulfur-containing compounds like allicin derivatives, S-allylcysteine, and other bioactive molecules into a system that now has different processing speed and capacity than it once did. In younger adults, the liver has strong blood flow, robust enzyme activity, and efficient detoxification pathways. The kidneys filter waste products at a high glomerular filtration rate, meaning substances are cleared relatively quickly. But as we age, liver mass slightly decreases, hepatic blood flow declines. Phase 1 and Phase 2 detoxification enzymes may slow down. Kidney filtration rate gradually drops, even in healthy seniors with no diagnosed kidney disease. This doesn't mean failure, it means reduced reserve. Now, imagine introducing a concentrated garlic extract into this system. Unlike using 1 clove of garlic in a meal, concentrated extracts can deliver higher and more standardized doses of active compounds. These compounds must circulate through the bloodstream, pass through the liver for metabolism, and eventually be excreted, partly through urine and partly through breath and sweat. If liver blood flow is reduced, the first-pass metabolism of these compounds can change. Some substances may remain active longer in circulation. That means the biological effect may last longer than expected. For example, garlic's mild blood-thinning properties could be prolonged. In a senior whose platelet function is already altered due to age or medication, that extended exposure can increase bleeding tendency more than anticipated. Now let's talk about enzyme activity. The liver uses a family of enzymes, often referred to as cytochrome P450 enzymes, to metabolize many compounds. Aging can reduce the efficiency of certain enzyme pathways. That means a compound that is quickly broken down in a 35-year-old may linger longer in a 75-year-old. With concentrated garlic extracts, especially those taken daily, this can lead to accumulation of metabolites, not necessarily toxic, but more persistent. And persistence matters, because when compounds circulate longer, their interactions with medications also extend. Many seniors take multiple prescriptions, blood pressure medications, cholesterol-lowering drugs, diabetes medications, anticoagulants. Polypharmacy is common after 65. If garlic metabolites remain active longer due to slower hepatic clearance, the window for interaction increases. Let's shift to the kidneys. Kidney function is measured by something called glomerular filtration rate, or GFR. After age 40, GFR can decline by about 1 neuron per minute per year on average. By the time someone is 70 or 80, their kidneys may be filtering significantly slower than in midlife, even if blood tests are still technically within normal range. What does that mean for garlic extracts? Many sulfur compounds and their metabolites are excreted through urine. If filtration slows, these metabolites may remain in circulation longer. This extended presence can intensify systemic effects. For example, blood pressure lowering properties may become more pronounced. Seniors who already have tightly controlled blood pressure may experience episodes of lightheadedness or orthostatic hypotension when standing up. Another layer is protein binding. Aging can alter levels of plasma proteins like albumin. Some compounds bind to these proteins during circulation. Changes in binding can increase the proportion of free active compound in the bloodstream. Even subtle shifts can amplify biological effects. There's also the issue of reduced renal reserve. Younger kidneys can compensate quickly when exposed to increased metabolic waste. Older kidneys have less flexibility. If a senior becomes mildly dehydrated, which is common due to reduced thirst sensation, kidney filtration can drop temporarily even further. Now imagine taking a concentrated supplement during a period of mild dehydration. Clearance slows even more. Effects intensify. This is why two seniors taking the exact same garlic extract dose can have completely different experiences. One feels fine, the other experiences dizziness, prolonged bruising, digestive discomfort, or fatigue. It's not about the supplement being inherently dangerous. It's about biological variability amplified by aging physiology. Let's explore liver detoxification phases in more detail. Phase 1 reactions often involve oxidation, reduction, or hydrolysis, making compounds more reactive. Phase 2 reactions conjugate these metabolites, making them water-soluble for excretion. Aging may not uniformly slow all pathways, but overall efficiency can decline. Nutritional status also plays a role. Many seniors have marginal deficiencies in nutrients required for optimal detoxification, such as B vitamins, magnesium, or glutathione precursors. If detoxification capacity is reduced, reactive intermediates may persist slightly longer. Garlic sulfur compounds are biologically active and interact with cellular signaling pathways. Extended exposure may amplify antioxidant effects, but it may also increase gastrointestinal irritation in susceptible individuals. There is also the concept of hepatic sensitivity. The aging liver may be more susceptible to stress from multiple compounds processed simultaneously. When a senior takes 5 or 6 medications plus 2 or 3 supplements, the metabolic load increases. Even if each compound is safe individually, the cumulative burden matters. Kidney aging introduces structural changes as well. There is reduced renal blood flow, decreased nephron number, and changes in tubular function. Tubules are responsible for reabsorption and secretion. Alterations in tubular handling can influence how metabolites are eliminated. Some compounds may be reabsorbed differently, affecting plasma levels. Let's consider a real-world example. A 74-year-old woman takes an aged garlic extract standardized for SLL-cysteine. She also takes an ACE inhibitor for blood pressure and a low-dose diuretic. Her kidney function is mildly reduced, which is common for her age. She begins to notice increased fatigue and occasional dizziness. Blood tests show her kidney function is stable, but at the lower end of normal. The garlic extract may be exerting additive blood pressure lowering effects that persist longer due to slower clearance. The diuretic increases fluid loss, and mild dehydration further reduces kidney filtration temporarily. This combination creates a subtle but noticeable shift in how she feels. Another factor is inflammatory status. Aging is associated with low-grade chronic inflammation, sometimes called inflammaging. Garlic compounds have anti-inflammatory properties, but the metabolism of inflammatory mediators also involves the liver. When hepatic processing slows, shifts in cytokine balance may occur differently than expected. The systemic response to garlic in an older adult may not mirror clinical trial results obtained in younger populations. Clinical trials often exclude very elderly participants or those with multiple comorbidities. That means safety data for concentrated extracts in 80-year-olds with mild kidney impairment may be limited. The absence of widespread reports does not automatically mean universal safety across all physiological conditions. We also need to discuss oxidative stress. Garlic is often promoted for antioxidant capacity. However, antioxidants themselves are processed and metabolized. The redox balance in aging cells is more delicate. Mitochondrial function declines with age. The liver's capacity to regenerate antioxidants like glutathione may be reduced. High doses of certain compounds can paradoxically shift redox signaling in unexpected ways when detoxification pathways are slower. Another subtle issue is drug transporter proteins in liver and kidney cells. Aging may alter expression of transporters that move compounds in and out of cells. If garlic metabolites rely on these transporters, altered expression can change intracellular concentrations. This can influence how strongly the compound affects vascular tone or platelet aggregation. Hydration status deserves deeper attention. Seniors often drink less water because thirst perception declines. Dehydration concentrates substances in the bloodstream. If garlic extract metabolites are circulating in a slightly dehydrated system, plasma concentration rises. That can magnify effects without any change in dose. Body composition changes also matter. With aging, lean body mass decreases and fat mass often increases. Distribution of fat-soluble compounds may differ. While many garlic metabolites are water-soluble, distribution dynamics still shift with body composition changes. Volume of distribution influences plasma levels and duration of action. Let's not forget that liver regeneration capacity decreases with age. While the liver remains remarkably resilient, recovery from stress may be slower. If a senior experiences mild liver enzyme elevation due to medication, adding concentrated supplements may complicate the picture. Even if garlic itself is not directly hepatotoxic in typical doses, combined metabolic stress can tip balance in vulnerable individuals. Kidneys also lose some adaptive capacity. When exposed to sudden increases in metabolic byproducts, they may not adjust filtration as efficiently. Concentrated extracts produce higher metabolite loads than culinary garlic. This difference is critical. Whole food garlic consumed in meals spreads intake over time and includes fiber and other food components that modulate absorption. Capsules deliver a bolus. Absorption rate influences peak plasma concentration. Rapid absorption combined with slower clearance can produce higher peaks and longer duration in seniors. Peaks are often where side effects occur.